masole a peo ya motho wa ntate ha a fokola o iphumana a lahlehelwa ke morolo le matla a ho kgotsofatsa mofumahadi ka bokgalebe ya hae e leng sesosa se etsang karohano pakeng tsa bona ba le babedi kapa ho se tshepahallane. Tested power ke moriana pitsa e kopantsweng ka ditlabatlama tse fapaneng tse nang le matla a ho tiisa peo ya hao le ho fa morolo bakeng sa nako ya tjhetjhellakwana. Tested power ke moriana wa bontate iphumane le yona hona jwale ka maleka progesterone wa baba Mswati kapa o ka ifumana ka Oma 7 Cal progesterone tharollo ya mathata a bontate. It offers the best tapes for your week.
22 minutes after the hour, 11 o'clock, right here, Mo Akhanang FM. Unsere diese thulaganyo ya Itsoseng, hona le nna Tiisetso ko ga Motingwe. I did tell you hore every Wednesday we get to look at Women Health Wednesday, mo kgweding ya August, as it is Women's Month, right? And we started off with Dr. A.Matube, and he is right here again today. Doctor, good morning.
Good morning, how are you?
I'm good, and yourself?
I'm fine, thank you.
Thank you. Thank you for joining us once again.
You're welcome.
We appreciate the information right here onto the show.
And I also appreciate the opportunity to be sharing.
Thank you, thank you. So today's topic, we're talking about menopause, right? A stage or phase, I'm sure every woman is like, I give a go. You know, we don't actually know, you know, the in depth or what is it that we're going to experience when we reach that phase. But we're all like, already there's a lot happening with us. We do not want to get there. So for someone who doesn't know what menopause is, how would you describe menopause?
All right, at least lucky they have you to be the facilitator of this information.
Okay.
Because it's very important. So menopause, we define it as a period where a female stops going to periods for a period of 12 months. And the average is about 51 years of age.
Okay. All right, so now when you get to that age, as you say, your period stops and all of that, is that the only sign or symptom that shows you that you have reached that phase of menopause? Or are there other things that they happen within your body?
Oh, okay. So remember that our body is dependent on what we call hormones to function. So the fascinating part about the female body is that you are already born with the ovaries and with the eggs, what we call the eggs. So throughout the period of your lifetime, they keep on going to menstruation, and then they lessen with number up until a certain age. And that certain age usually is about 45 to 47 years of age. That's when you experience what we call premenopause or climacteric period. So what happens there, you start having irregular menses, and you also start seeing changes like hot flashes sometimes with people, or night sweats, or sometimes mood swings. You just don't feel like you are yourself anymore, and you get irritated a little bit. And the other thing, it could be vaginal dryness. So now during intercourse it becomes more painful, and that also causes a problem within the family. Remember that sex is very vital to bond family. Now once it's tempered, it brings difficulties in the family. So now the woman doesn't know what's happening with her, why she's no longer lubricating well. That could be the sign of menopause.
All right. So I believe that there are different signs that you get, right? So how can they now differentiate between signs that show that you have reached that phase of menopause and you know, having other terminal illnesses? All
right. So the main changes here is the estrogen, which is the main hormone for females. So once it stops being produced, you won't see your period for about 1 year period. That's when we say you are menopause.
Okay.
And then we have what we call vasomotor symptoms, which are night sweats, and then the other one would be hot flashes. Yes, and then we have neurological or psychological effects. Now that's when you have your mood swings, sometimes your sleep disturbances, and sometimes it can be even a depression itself. And then there's what we call urogenital syndrome or symptoms. So what happens is that once the estrogen is low, the vagina, the bladder, and then the back, what is it, rectum, the atrophies, meaning they reduce in size. I can say I'm not sure is it even a correct term to use. And then once it does that, there's also vaginal dryness into it. But the problem is that when they decrease with size, now you have difficulty with urinating. You hear and then you can get fractures easily. So that's the most difficult one, because obviously when you are fractured, then now for about 8 weeks, it's not nice. And then the other one is we see most of them having difficulties with cardiovascular system, meaning heart attack.
So now when all of that happens within your body, I believe that to assist in a way, there's some sort of lifestyle changes that you need to now put in place into your life, right? So what are some of those lifestyle changes that women can make when they reach that stage of menopause?
I mean, the main problem with today's population is that we are facing difficulties only with lifestyle itself. So if we can change lifestyle, definitely we will sort out most of these problems. So you don't have to wait to that age to actually change your lifestyle. The diet is the main thing in here. So with diet, you want to look at food that can actually help you produce what is this, estrogen. Remember that hormone that I was talking about, that it stops being produced. So there are food like that, like body soya, you can even just Google them and see them and put them into your diet. And the other one, because of the fractures that we are expecting later on in life, you really want to exercise throughout your active years, so that your bones get so stronger. By the time you get there, you don't have problems with bone density. And also it will also help with high blood. Just gymming helps with high blood related problems. So now you're sorting out also that part of heart attacks and then high blood and all the stuff.
All right, so in addition to what you've said with changing diet, exercising, are there like vitamins and supplements that you can also add to help out?
There is what we call hormone therapy or hormone replacement therapy. We don't really like it that much. We only prescribe it when it's necessary. So basically hormone replacement therapy, it means that we give you the hormone that you need. So it does have side effects, so hence we don't really like it that much. Sorry. So what we normally do is that we want to check if ever is it indicated for you, for us to give it to you. So some of the indications for that is when you start having hot flashes. So when you have hot flashes, then we give it to you. And then the other one is when you have what we call premature menopause. So when you have menopause before 40 years, it's premature. We're not expecting it to happen at that time. So then we'll give you hormone replacement therapy at that time. And I think I forgot the other ones, but yeah, those are the major ones. And remember that menopause is not always caused by age. Sometimes you might have to we might have to do surgery and remove the ovaries, the eggs. And once we do that, immediately there's no production of estrogen, and then we cause menopause. So it's surgical menopause, that one. And then sometimes some people, they find themselves having cancer and they have to go for chemoradiation. And during that chemoradiation, that chemo might actually destroy the ovaries, and then eventually they get menopause from that as well. So let's not just limit it to age.
I love the fact that you also touched on that, so that people can know when they go to a doctor because of certain surgeries, operations that they had. They don't say, oh no, the doctor says I can only menopause, but I'm like 35 or whatever. So now at least they know that no, there are different types of menopause rather that you can get.
Yes.
That's very interesting.
It is interesting.
Because I believe a lot of people always think of it as age. You know, no, you only get menopause when you reach a certain age. So no, thank you for shedding light, you know, with that also. So now you spoke about hormone replacement therapy, right?
Yes.
So is it safe also regarding with age? Right, as you say, there's early menopause. So is there any, or are there any risks to it?
With regards to anything that we give you as a drug, there's always side effects. There's always risk attached to it. So one of the major risks into this one is that once we give you that, it can cause, or it can cause a cancer of the womb, so endometrial cancer. So that's the problem. That's the major problem why we don't really like it. So there's a space where if you don't have a womb, it's better for us to give it to you. We are not worried about that cancer of the womb. But once if you still have a womb, then we have a problem with the cancer, because cancer kills. So it's our major problem. And then the other risk factors with it is that of the bone density. Remember, once we start giving it to you too much, it actually lowers your bone density, and it makes your bones weak, and then you can get fractures at any time. So onkarobe at any time. So we don't really like it for those factors.
All right. So now, a woman that would like to know, you know, have they reached that stage or not? What are the screening or checkup methods they need to do, whether it is before menopause, during menopause? Are there any?
So the main thing, this thing is it's not an investigation type of diagnosis, meaning we don't need to do something to diagnose it. From a history only, we can actually stipulate. Meaning that if you don't have your periods for 12 months, then we can do that. We can say you are not, okay, you are menopause.
Okay.
And also we can just check your background, like how old are you and stuff. But in a sense where we are not 100% sure. Remember, I've spoken about that hormone or estrogen. We can just check the level of it. Where is it actually? Then it will be able to tell us that it's not produced that much in your body, and hence then will make a diagnosis out of it.
All right. 11:34 onto the clock. Itsoseng, Tiisetso, and I'm with Dr. A.Matube, and we're talking about all things menopause. Right? Just letting you know that changes that happen in your body are natural. Right? Natural, you are going to experience this. And I believe that I don't want to get much into the male part of the body, but as much as women, we have different things that we're going to experience as we get older. I believe also with men, right? There are their own issues that they experience, right? Indeed. So it is normal. That's what we need to know, that it is normal. So you touched on getting mood swings and what other things that you can get, you know, with regards to being during that phase, menopause. Can you be depressed? Can you get for anxiety? Are there also those symptoms part of the phase, menopause?
Oh yeah. So I think one thing that I was trying to classify them in different categories. Remember, I said vasomotor symptoms, the ones that I was talking about, hot flashes, and also the what is this? Is it hot flashes and night sweats? So there is other one that we call palpitations. So you feel like there's fear in you, like your heart just beats too rough, and when it does that, you will definitely have some sort of anxiety, because now it's a strange feeling, just feeling your heart just beating too fast and too rough. You're asking yourself, what is that? Yes, with neurological symptoms, you will have a decreased libido, meaning takatso ya thobalano ya ko tlase. That's a major problem, definitely. And then with that also, obviously, it will affect the function of the family itself. Because now as a woman, you don't want to sleep with your partner, and your partner really wants this. So now it also causes conflict in the family. But the other one is depression itself. So you always have a low mood. You don't know why, because you're no longer yourself. It is a challenging thing. I mean, depression is not an easy thing to deal with. Definitely, you need a lot of assistance when it comes to that. But you need your family to be understanding that you are going through changes. So if they cannot support you, especially emotionally, then it makes matters worse. Yeah, I think that's about it.
Yeah. So touching on family and them being supportive and being there for you.
We need to be able to understand it, that it will affect every woman who gets to a certain age. And by us being prepared to go through it with our loved ones, it will really help for them. Because in that stage, they also don't know themselves. Because you become a new identity. Remember that you used to be active, you used to be this person. Now you are changing and you don't know, and you don't call it upon you. It just comes to you. So definitely, let's support our women through menopause, and it gets better with time, because that change itself, it's so drastic and very challenging. But eventually, later on, they post now. There's no problem, and then you get your personality back, and fast forward, we enjoy life again.
So you're saying the body gets used to it, meaning there's no starting period of menopause and ending period of menopause. It's just when you reach that age, when you get menopause, your body adjusts and you sort of now live with it. But there's no age that says, okay, no, you get menopause up until you're 90, and then afterwards, no, you're good.
No, it's a lifetime. It's a lifetime thing. Remember that I said to a certain age, the eggs stops being produced, and then the hormone stops being produced. So,
or do they just have to wait and see?
Nah, I wouldn't say wait and see. I mean, having knowledge of something, it makes it better to be like psychologically prepared. And then the other thing we said, lifestyle modifications. It's always best, at least, to keep your body in shape for when now you are facing all this health challenges. At least your body is fit enough to take care of that as well. And it's also good when you know about this problem, you can at least engage your family early on, because when you are in that state now you are having moods and then you are depressed, it's not the best time to start talking about it or to start fishing around what is this problem. It's always best when you are still young. I think feminism should start talking about these things, especially as early as 30 years of age, so that at least when you get to 45 and you start seeing these changes, you've already known about it. It's not a surprise.
No, thank you so much, Doctor, for joining us on the show. We appreciate you sharing this, we were talking to Dr. A.Matube on the topic of menopause right here, Itsoseng.